Hello, everyone. Thank you for joining our lunch lab today. I am Sally Delisle, co-owner and director of trainings at ChildLight Education Company, where our mission is providing wellness education to create happy, healthy, and resilient youth and families. Today, we are talking with Megan Morris regarding life as a doula. Hi, Megan.
Hi, thank you for having me.
Thank you for being here. So many of you already know Megan from one of her many roles, either as my friend, colleague, and co-owner of ChildLight. She's a yoga teacher. She's a new realtor in the Lehigh Valley of Pennsylvania. She's a baby toddler teacher and teacher trainer for ChildLight. She has also served as a birth doula for many years. And she is a wonderful mom and wife.
Thank you.
So, Megan, do you want to add anything to that before we move forward talking about doula life?
That was a very nice opening. No, thank you. Very generous.
Check, 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 check. Welcome.
Thank you.
So, Megan, before we really talk about life as a doula, everyone may not know or be clear on exactly what a doula is. And oftentimes I hear, oh, so you're a midwife? And I have to say, no, I'm not a midwife, I'm a doula. People are sometimes confused about the difference. So would you walk us through exactly what is a doula? What is the role of a doula? What's the difference between a midwife and a doula?
Happy to, yeah. So we do get this question a lot when families are reaching out. So I actually have a PowerPoint that I've put together that helps me with initial client consultations so that I don't miss anything. So I'm going to share that with all of you today. I think it would be helpful. Great. So here we go. That's my child's birthday party. All right. So life as a doula. A midwife. So the definition of a midwife are, the easiest way to think about this is that midwives are the medical side of birth, healthcare providers who assist with pregnancy, childbirth, newborn care, and postpartum health. And some midwives also provide routine reproductive care like pelvic exams, pap smears, counseling on birth control. And midwives tend to be more holistic and supportive of natural approaches to birth and pregnancy compared to some obstetricians that you are meeting in the hospital. However, some midwives also do work in the hospital setting. In Pennsylvania, there are midwives in hospitals, but they are not allowed to catch babies. So most of the midwives that I work with are home birth practitioners. Now, a doula could find themselves in a home birth or a hospital birth. And a doula is different in the sense that they do not have, typically doulas do not have formal obstetric training. We are employed to provide emotional, physical, and educational support to a pregnant person who's expecting or is experiencing labor or has recently given birth. So there are birth doulas, there are postpartum doulas, there are even death doulas, which is a totally different world in doula work, but it's a really important world of our work as well. So the purpose of a doula is to help families have a safe, memorable, and empowering birth experience. I have put together the history of doulas for you as well. So, you know, people have been supporting other people in childbirth since the beginning of humanity. And there's evidence of that in stone carvings and statues from prehistoric times that show birth companions. In the 1960s, the modern doula first emerged. Women started to become more interested in unmedicated, low intervention birth. And I'll talk more about how that's really enhanced with the support of a doula. Right at the end of the 1960s is when we saw the term doula first used in a medical study. And the term is derived from modern Greek, meaning woman's servant. And then more recently in 1992, that's when the very first doula training certification program came into existence. We started to see a whole lot more doulas after that. And then about 20 years ago, the term doula was added to prominent dictionaries and therefore became super legit. So a doula's scope of practice, knowing what that is really important. We're present with the pregnant person and their partner in labor to provide emotional and physical support. We do this by way of massage, helping them find different positions to make labor more tolerable, and other techniques for comfort, of which there are many. We can also really help our clients feel more informed and empowered by sharing knowledge prior to Labor Day. It's important that they start to get this knowledge during their pregnancy so that when they are in labor, hopefully they're not taken by surprise by the process because they have the knowledge previously. And then a big part of our work after the birth is to make sure that they feel supported in the postpartum period. That's typically the hardest time for new parents. And we really want to make sure that they feel like they have the support they need around them to get through that challenging time. So the doula works for the family that hires them. The doula does not work for the care provider or the facility where the client is giving birth. It's important that a doula actually doesn't speak directly to care providers about what their families want or need in the moment. It's our job to discuss these things with our family that we are hired to support, and then empower them to speak directly to care providers about what they want and need.
Megan, before you go on,
Yeah.
in this first point here, you mentioned that a doula assists with massage, positioning, and other techniques. Can you give us an example of what you mean by that?
Sure. So I've noticed a lot with my clients that they hold a lot of tension in their shoulders and their jaw. And the jaw muscles are actually directly related to our pelvic floor muscles. And if we're tense there, it's going to be really hard for the pelvic floor to release and rest enough for a baby to pass through the birth canal. So whenever I'm noticing a lot of tension in the upper body, I might just gently put my hands on the shoulders and say, release tension in the shoulders, release tension in the jaw, show them different techniques for releasing and relaxing the jaw, like things we do in yoga with lion's breath can go a really long way. Just opening the mouth really wide, sticking out your tongue. It's a really big deal for people who are in labor to help move things along in the right direction. And I might even massage the shoulders. There's something called the double hip squeeze, where you put your fists into the sides of the hips and squeeze in and up to help with pain management, but also to help promote baby moving down through the birth canal. Putting pressure on the sacrum can really help with alleviating pain, reducing it, not alleviating it, but reducing it, making it more manageable. A foot massage can go a long way. I know that you're good at that. And yeah, with positioning, when you're in a position for a long time and you're in agony, it's important to change positions. And that's why I never like to see my clients just stuck in a bed with a bunch of wires hooked up to them. They need that freedom of movement. When you're free to move and seek comfort however you feel, that helps with labor progression. You need to feel safe in the space that you are laboring in. You need to feel the freedom to move. So that's what I'm there to remind everybody of. I was just at a labor a couple months ago. I showed up. I could tell that mom was in a lot of pain. And I said, are you open to getting in the shower? She said, yes. She went in the shower. We pointed the water right on her back. And she's like, oh my God, this is so much better. She was so grateful. And she stayed there for like a whole hour, maybe 90 minutes. And then her water broke. And then boom, 20 minutes later, she had a baby. It's proven time and time again that being able to help people navigate what they should do next will help with progression.
Thank you so much.
Yeah, thanks for asking. All right. So what a doula does not do, we don't perform clinical tasks. We don't take blood pressure, heart rate, vaginal exams. None of that is our gig. We don't make decisions for our clients. We're helping to guide clients into the best informed decision for them. There's an acronym that we use called BRAIN. So when a care provider comes in and says, we're recommending this as a next step, whether it's because labor is slow to progress or they're concerned about something, if they're essentially introducing some kind of intervention that they think will help, our job is to empower the client to ask the BRAIN acronym. So what are the benefits of this suggestion? What are the risks? What are the alternatives? You know, sometimes there's something a little less invasive that could be tried first. What does your intuition tell you? Because whatever your gut's telling you is important too. You can't deny that. And then what would happen if you did nothing? Because there's rarely anything in birth that is so much of an emergency that you couldn't take an hour to think about it and to discuss it with your partner and doula, whoever's on your birth team, to come to a more informed, clear-headed, calm decision, not something that is happening in the moment that feels really stressful. We have to give ourselves that time and space, just like any other big decisions we make in life. So we're there to help guide the clients, but not make decisions for them. And then another thing we do not do is speak, as I said, directly to the medical staff on the client's behalf regarding matters where healthcare decisions are being made. I certainly like to make eye contact with doctors and nurses and thank them for what they do. And I like it when I feel like I'm part of the team, but I would never turn to the doctor and say, you know, so-and-so said that they want this or that done next. I would say, okay, you have to let the doctors know what you want to do next. And then a big thing that we don't do is replace the partner. And I get this a lot in interviews. I always make sure that I say, you know, partners have a really important role in this process. Birth outcomes are usually more positive when there is a partner that is really invested in the process. You know, I know that I've heard a lot that partners can be squeamish. And in that case, I'm there to help to make sure no one's passing out or making things harder because they're having a hard time with seeing blood and whatever it is that's coming up. But most of the time, partners are really willing to jump in there and be helpful. They just don't know how to do it. So suggesting that the partner be part of the rhythm and the ritual that the birthing person has created to make the pain more tolerable is really important. So the doula is there to help empower and support both the partner and the laboring person. If labor's been going on forever, you know, it's really nice to be able to step in at the right time and say, hey, partner, go get yourself some food, go take a lap, maybe lie down if you can. I'm here to help, and I'll let you know if anything gets interesting. You can come right back. You're not going to miss anything. And that way everyone keeps their energy where it needs to be.
That's right. And in regard to the partner, Megan,
Yeah,
a couple of points there. Sometimes there is no partner, and
right.
it can be that partner, that support person.
Yep, absolutely.
And other times the partner may be a sister, a brother, a parent, a cousin. A partner can be all sorts of different people, not necessarily a spouse, a girlfriend, a boyfriend, right?
Yeah, thank you for saying that. There have been a lot of births I've attended where it's not a romantic partner. Yeah, it's all the other things you just mentioned. We've had some really great you know, parents in the room and sisters and friends, and that's just as important and special that those partners feel valued and that they're really helping. So why would someone want a doula is another important question that we need to be answering in these consultations. The American College of Obstetricians and Gynecologists has called doula support one of the most effective tools to improve labor and delivery outcomes. And that is a very big deal to have this organization say, like, we think doulas are helping people have better birth outcomes. And here's just some statistics that also came from that, from various studies, but studies have shown that births have a 25% shorter labor, 30% reduction in different kinds of anesthesia use, 40% reduction in synthetic oxytocin use, which is the oxytocin is synthetic oxytocin is like Pitocin. If you've given birth, you may have heard that term before, but it's a medication that helps augment labor contractions. And it can be quite painful. It's much harder to labor on Pitocin than to just be able to labor without it. 40% reduction in forceps delivery, which is the tongs, for a lack of a better word. That's what they look like. They go on baby's head, and with the contraction trying to pull baby out, there's some risks with that. My dad was a forceps baby, and he still has the marks on his head to prove it. 50% reduction in cesarean rate, C-sections, and 60% reduction in epidural requests with a doula in attendance. It's some pretty awesome statistics.
Mm-hmm.
And then additional benefits that I just must include are, this is a really big one. If we can go into birth with less anxiety for the birthing person and the partner, you're definitely going to see better birth outcomes. It's very hard to labor and give birth if you're full of anxiety over what you have to do. We're going to see fewer medical procedures in general, better APGAR scores after baby's born, increased satisfaction with the birth experience. Hopefully they're looking back on it more fondly because they had that additional support. Increased breastfeeding success, since that's something that we really help with immediately after birth. Before I leave, I'm doing my best to make sure baby has latched in the first hour or two after birth. And if latching hasn't happened, I'm checking in with them, every day after the birth to see what kind of support they need so that they can have success in breastfeeding if that's what they desire. And then decrease postpartum depression and anxiety with doula support. I always make sure I do a postpartum depression and anxiety screenings within a week after the baby's born, since unfortunately a lot of people aren't receiving any kind of follow-up from their care providers if baby was born in a hospital until 6 weeks after the birth. And that's just far too much time for things to go wrong and to not have the support that you need. So a doula can really help with that part of the experience as well. So if you wanted to hire a doula, how would you find one? I like these options. The first two are going to help guarantee that you get a more personal recommendation. Local prenatal yoga classes, if you can find them. I know they're not everywhere. And birth education classes are a good place to learn about doulas in your area. But Facebook parent groups have been a really helpful resource in my area. I am tagged constantly on Facebook parent groups whenever someone says, I'm thinking about hiring a doula, and then people just post their recommendations. And that way they're getting a more personal recommendation on who they might want to hook up with. But then these last two websites, doulamatch.net and hellomila.com, is a newer platform for a place to get matched with a doula in your area. There's usually testimonials attached to the profile. The profile will mention what the doula specializes in, how many births they've attended, what their range of their rates are, if it's on a sliding scale, what the different packages include. It'll lead you to their websites. So that's a nice way to shop around and learn more about who's in your area. And if you're watching this and thinking, what if I want to become a birth doula? How do I do that? Well, you got to complete a birth doula training. I mean, really, you don't have to, but we highly recommend it. The training gives you the basics of what you need so that when you do get into the labor room, you feel prepared, you feel ready for that first prenatal visit that you have with your family, you feel prepared for the first postpartum visit, because there's a lot to know. There's a lot to think about before you're actually in the room. So as I said, there are different kinds of doulas. So when you're searching for a program, make sure you're looking for a birth doula. I'm just saying that because that's what this whole lunch lab is focused on. But there, you would actually do a whole different training to become a postpartum doula, and death doula is a whole other sector. But we have our doula training program through ChildLight, and the link is there at the bottom if you want to check it out. And Sally and I created this training together, so we'd be very happy to answer any questions you have about that process. And then the last thing I just have here is some resources. The first two things listed here were just the two things that really inspired me to become a doula after I read this book, Ina May's Guide to Childbirth. And especially after I saw the film, The Business of Being Born, I felt really passionate about making sure that I could support as many families as possible. And then, of course, making sure you have the training to do it. So that's that.
Thank you, Megan. That was really helpful and very comprehensive.
Oh, good. Thank you.
If people have questions after that, they can always reach out to us. I do have a few more questions myself that people may have.
Sure.
How can a doula make it clear when they're at a birth, if someone does decide to become a doula and they're there, how can they make it clear to the medical staff and the birth family that they're there as a positive bridge between the two? Because I do encounter questions from people, especially medical staff. We act as kind of a middleman, a middle person between the two, and we don't want to be there as a watchdog per se, like don't do this, don't do that. We're there in a positive light. So how do we actually portray that? Do you have some tips and tricks for that?
Yeah, you know, that dynamic used to concern me a whole lot more when I first started doulaing. And then as time went by, I started to see that a lot of doctors and nurses were typically becoming very welcoming of doulas. And I'm very grateful to be in an area where that's the experience, because I understand that's not the case everywhere. I love it when I walk into a hospital room and I see a doctor that I've worked with before or a nurse that I've worked with before, and they're like, hey, this is going to be great. They treat me like I'm part of the team. And that's like the greatest scenario that you could imagine, because there's no sense of like, oh, the doula's here, she's going to make everything harder now. But unfortunately, that is sometimes the experience. So I always make a point to really introduce myself warmly to the staff. Anyone who walks through the door, you know, there shouldn't be any question about who I am or what I'm doing there, and lots of smiling and, you know, be polite, just like you would in any scenario. Please and thank you go a really long way. I always try to make sure I'm never in the doctor's or nurse's way. Like if there's something I can help with, I will, but I typically try to just set up my own little place where I know I'm not going to be in anybody's way. And I always, you know, try to, we do this in the training, you know, remind doulas that we're not meant to be the center of attention. It's not about the doula, it's about the birth family. And that's part of honoring our scope of practice, you know, allowing the family to speak for themselves, empowering them to do that. But just helping everyone feel like the doula is just part of the team helps things run a lot more smoothly. You know, nurses and doctors are really busy. They can't be there all the time. Nurses are assigned to a lot of different people on the floor usually. doctors might be getting called into emergency C-sections or just have a lot of people giving birth at the same time. It's very rare that a doctor can hang out for 3 hours while a client is pushing, you know? So we're there. It also helps that we know the birth family pretty well. You know, we've been working with them prior to Labor Day. And so they trust us. We're that constant. Once we get there, we're not leaving. We're there for them, where nurses come and go, doctors come and go. So I think that's why nurses and doctors are so grateful when they have a doula in the room who's not like trying to call the shots in any kind of negative way. It's just that extra support person, just as we're intended to be.
Beautiful. Mm-hmm. Really nice. And absolutely the medical staff, doctors, nurses, they work so hard to support so many people. I'm so grateful for all of our first responders. We need to give them a big shout out. And that's why I feel that the work is so important. Anything we can do to support them and support the birthing families, it's an honor to do that work.
Yep. And you know firsthand how important those first responders are for your first birth, right?
Yes.
Yeah.
Yeah.
You want to tell people about that?
No. Another time.
Okay. Little cliffhanger.
It's hanging. I do want to share this though, and that is you brought up when people are coming and going, you make it a point to smile and introduce yourself and let them know that you're the doula. And I remember talking to you about this because people would come in and they would meet the family and then they'd look at me and say, "And who are you?" And I would have to say, "I'm the doula," and they'd say, "Okay." So I said to you one time, I need to get a shirt or a great big name tag, because I would write Sally, the doula, on my name tag, but it was never big enough. And you bought me this awesome shirt, and I have it, and I wear it. Nice. And it says, "I'm the doula," in great big letters. So now when people walk into the room, they just look at me and go, "Okay, you're the doula."
Nice. That's great.
No doubt. It's super easy, because sometimes you're there for a long time and the staff changes. So you're constantly reintroducing yourself to people.
That's right.
Yeah, so that's very helpful. So lastly, Megan, what are some personal pros and cons that you have learned over the years as a doula?
Yeah. I mean, I think there are so many pros to what we do. You know, every time I watch a baby come into the world, I cry. It's like a reset button on my faith in humanity.
Yes.
Knowing that I've positively contributed to someone's birth experience in a small or big way is everything. That's the whole point. Helping to educate and empower families to have a birth that they can look back fondly on is, exceptionally gratifying. I always love it when I work with clients who are really excited about getting educated, like they want to do the research. Maybe they already know they want to doula because they've already done all the research, but they just want as much as they can get so that they can walk into their labor with a lot of confidence and reduce fear. That's a really important part of it. And for things to go smoothly, it's really important that people don't walk into it with a lot of fear. And it's too easy to walk into birth with fear because all of the messaging in our society says things like, like watch any movie. A woman's water breaks, she starts screaming, and then there's just screaming until a baby is born.
True.
And that's not necessarily how it needs to go. And it's rare that it does go that way. But if that's, when people are pregnant, they just get terrible stories thrown at them for a whole 9 months. You can't even go get your nails done without a stranger next to you saying like, "Oh, I had a 48-hour labor and everything went wrong. And I pushed for 4 hours and everything still went wrong." And you're like, why are you telling pregnant in people this kind of information when they need to feel empowered and confident, and we need to reduce anxiety, because if you walk into a birth feeling super anxious, there's a good chance it's not going to go well. I really, over time, that's what I've come to realize, that if you don't have tools for calming that anxiety when it matters most, then it will be a really challenging process. And I really want my clients to avoid the cascade of interventions. As I've said a few times, that's the con. Sometimes things don't go as planned, and you do see, a lot of the time someone's stuck at 6 centimeters, and a doctor will come in and say, well, this bed is for people in active labor and you're not in active labor, but they're not going to send them home because they're 6 centimeters. So now they're getting pushed into a place where it's like, if you don't do what we recommend, we're going to have problems. And sometimes people are forced to do things sooner than they should have to. And that kind of stuff can really get me down when I see that part of the birthing world at play. It can be really hard to see that happen. But it's still always a really good learning experience for me. And I always try to make sure I'm giving those families the support that they need if there was birth trauma, and making sure that they, get what they need in the postpartum period to heal physically and emotionally if needed. Birth is still such a mystery. Even though we've been giving birth since the beginning of humanity, there's still so much we don't know about it. We don't know why sometimes it doesn't go smoothly, and sometimes it looks like the easiest thing in the world, and that's what keeps me coming back.
Mm-hmm. It's always a surprise.
Yeah, no birth is ever the same. Every single birth, something happens where I'm like, that's never happened before.
Yep. And it's always up to the baby. It's not up to us in our timeline. You have to be patient.
Yes.
Always up to the baby when baby wants to meet the world.
And if we try to rush that, there can be problems. So
yes,
that's why we got to know how to navigate those issues when they come up.
That's right.
Yep.
Is there anything else that you want people to know on this topic before we sign off today?
Well, there's always more to know. So you don't even need to go through a doula training with the intention to be a serious professional full-time doula. It might just be for your own knowledge or to support a friend or a family member. If any of this work calls to you, I really encourage you to dive in and learn, because I would do it all over again, even if I never supported another person. I just love having this knowledge.
Yeah, me too. And you can do it in person, and you can do it virtually. I have done it twice virtually, and I'm actually right now supporting my goddaughter virtually. And depending on when somebody may be watching this Lunch Lab, perhaps her son could be 25 years old. But in the moment, he's not born yet. So there are lots of ways to support people, and knowledge is power.
That's it. Yep.
Knowledge is power. Thank you so much for sharing your knowledge of what it means to be a doula with our Lunch Lab ChildLight community. And I hope you have a great rest of your day.
You too, Sally. Thank you so much. Thank you, everyone, for watching.
Thank you, everyone. If you want to visit us, we are online at childlighteducationcompany.com. And take good care of yourselves. Go out there and do good in the world.
Yes.
All right. Bye.
Bye.